legislator, we got Joe Giroux, our Area 3 legislator. I talked to these two individuals down in Plattsburgh about 2 weeks ago, and we sent letters through the VFW and through the American Legion to each one of them, and voicing our concerns with our fellow comrades and sisters that use the home health care system. They both agreed, with no hesitation whatsoever, to come up here this evening to discuss a little bit what they know of the program, and also to take questions. They'll try to answer any questions that you might have. So I'll turn it over to you two people. Thank you.
Thank you, Jeff.
I'm sorry that we don't have the microphone hooked up. Celine and Joe said that they'll try to speak loud enough where everybody can hear. If not, we got plenty of open seats right up front.
I want to thank Joe Giroux, who's my fellow legislator. He's from Area 3, as Jeff mentioned. He's also chairman of our health services. As you know, the county legislature has 9 major committees, and Joe chairs health services. He's also a member of the Board of Health. I chair social services, so I have the whole Medicaid area. So between the two of us, we can maybe answer some questions. I'd like to make this as informal as possible because I know you have concerns, and whatever they are, let us know. So Joe also brought his lovely wife Carolyn here this evening. You know, behind every successful man is a great woman, and it's true in this case. I was looking at the calendar today, and I saw it was Grandparents' Day. So I want to wish all the grandmas and grandpa a happy Grandma and Grandpa Day.
Thank you.
I received a letter from Jeff that you had some concerns about home health care, and I will tell you a little bit what's going on and what has happened and why it's happening, and I don't have all the answers, but maybe Joe has them. As you know, home health care, most of home health care delivered in Clinton County is through our health department. Jack Andrews is our health commissioner. People pay through Medicaid, which is the majority of the people, or Medicare, or private pay, or insurance, however. The health department is a certified home health agency. They have about 360 patients. Then there's the long-term home health care division. There are about 50-some patients. These are the older, frail, elderly people who can stay in their homes with this extra care without having to go to a nursing home. It's better for them, and financially it's also better. So what is happening that we're here tonight? There's a lot happening in healthcare. There are a lot of major changes occurring. You probably read the newspaper, you see things yourself, you've heard about HMOs and managed care, you see urgent care set up, you see immediate care set up, you see private labs springing up, doctors have labs in their offices. It's not like you and I were when we were growing up, where you went to the doctor and you went to the hospital. Now you can go to a storefront and get your care. CVPH just bought the Paper Cutter Plaza. They're going to have their kidney dialysis over there. That's going to be health care. They have room in the hospital, but they feel this is a much better avenue. So things are changing. There's also, this is all part of deregulation. Also, Medicaid is starting to put a cap on reimbursement for hospital rates, for home visits, and they're looking for a cheaper way of doing it. So what has happened is private agencies are now looking at home health care and saying we can do it cheaper than a public agency like our health department. What has happened with the county legislature is we didn't go looking for this problem. We didn't even know it was out there. Jack Andrews came to see us in April, and he said, these are the things that are happening out there, and if we don't do something, something's going to happen to us. So I'd like to do a survey, he said, of the 3-county area, Clinton, Franklin, and Essex, to see if we can provide health care cheaper than doing it through our health department. This was news to us. The survey would cost between $12,000 and $15,000, and we turned them down. We weren't that concerned about home health care. If it was working, why change it? He came back again with representatives from Essex County and Franklin County, and receive some private funding to do this survey. So as long as it wasn't costing us anything, we said, well, take a look at it and see if there's a better way of doing it before someone takes it away from the health department. We do know that Warren, Washington counties are about to do something like that. That's the Glens Falls area. It's a private health agency. So the feedback hasn't come back yet on the survey, so we don't know what they're going to find, if it's a better way of delivering the care. We do know that CVPH has gone into home health care. They've combined with Evergreen. Evergreen Nursing Home, used to be Sacred Heart. They purchased senior services, which gave home health care to some patients. So CVPH has linked up with senior services, or Evergreen. I'm not sure what their name is. The hospital feels that the health care that the health department is giving, the health department nurses, is not adequate to meet all the doctor's needs. They are thinking of more high technology things, like IVs in the home and stomach tube feedings, and much more involved than the nurses are doing right now. You've all seen what's happening in the hospital. You go in for surgery and after 12 hours they release you, or 24 hours. So you know what happens to these patients. Once they get home, somebody's got to be there to take care of them. And some of these requirements take up more than what the health department can do. So that's being looked at. So one of the articles, Business Connection, county legislators quietly making effort to privatize home health care. That couldn't be any further from the truth. We've had two presentations from our Commissioner of Public Health. One was asking us money for the survey, and the second one was saying, I got money for the survey, can I go ahead and do it? We're not looking to change anything. If it works, we're very happy. Every legislator wants nothing but the best for their constituents. And so we will not do anything that would affect any recipient's home health care. No one is going to fall between the cracks. So we won't go into any agency or into any agreement that people would fall between the cracks and would be forgotten. I spoke with Bill Bingle, our county administrator, as recently as Friday morning, and I told him I would be here tonight. And I said, can I assure these people that they would get the same care regardless of what agency provides it? He said, absolutely. Also the same payer. So if they're Medicaid now, it'll be Medicaid. If they're Medicare, it'll be Medicare. If it's private pay, it'll be private pay. So what will change is the agency providing it, the care, not the care itself or the payer. But we don't know how it's going to change. I've told you, as far as we are now, we're at the survey level. And I don't know, maybe Joe knows when the feedback from the survey is expected. And from there, we'll look at it, and we don't know which way we'll go. But we have no choice. I think we're being forced into it because some of these private care agencies are going to come in and might take the patients around the city area, they might take the private pay patients, and they'll leave the outlying rural areas maybe with no care. We don't want that to happen. So we're going to have to start looking at it. Yes?
As long as the health department has the CHOP, we can't lose anything, can we? As long as we have
The CHA is the Certified Home Health Care Agency. That's the
and a
license.
private agency cannot purchase that unless the legislators decide to sell that, right?
You could consult,
Right.
but if we get deregulation, the CHA doesn't count anymore.
Okay, so when is deregulation? When is that coming in?
That's the whole catch. When does it happen? Does it happen next year? Does it happen in 2 years from now?
Right.
Now, the state has asked for the last 2 years, it's told us as a county health department that we should go with home health care, we should go into private business because that county shouldn't be doing this anymore. It should be private pay. We haven't done it. Mr. Andrews naturally has looked at it. It's his job, I think, as the health department administrator to look at these things, look at options. His option has been, and Mrs. Pocket did explain that, was a non-profit one. It was Tri-County. Whether that's the best or the worst, I don't know. The hospital has has had us over once and talked to us about it. Warren Cashier, who runs Evergreen Nursing Home, has invited a couple legislators to visit with him about it. I mean, we didn't go looking for these invitations. They called us and asked us because the hospital has applied for a partial license. Okay, if they pick apart a little bit of our program, what makes you say that they'll just take the IV patients? What makes you say as they go out of the hospital, they're not going to say, well, that one's a little bit tricky too, so because they have the control, see.
So until the deregulation happens, we really have nothing to lose until that happens.
If we keep hearing the cap, how much does it cost to do patients? Right now, the average of our county, so I understand by the health department, I'm not talking about what a nurse might say, is about 4 patients a day. The average in the private pay industry is about 8 a day. So if we stay, I think right now it's about $80 per patient per day that it costs for every visit that you make with the health department. That's what the social service program pays. And say the cap comes down to 60, we do only 4, but a private pay goes out there and does 8 at 60. What happens to us then?
At this point, is the county health department losing money? Is the nursing part of the health department losing money for the county?
It's about breaking even right now.
Or just breaking even?
Yes?
I understand that a lot of the nurses, you mentioned something about high tech. You got some very high tech nurses in Clinton County Health Department right now. And they're doing high tech because the hospital is kicking out patients before they're even ready to be kicked out.
That's right.
So they got some very high tech nurses doing a lot of high tech procedures that should have been done in the hospital.
That's right, yeah.
You haven't got any mandate yet from the state to do this. You have no paperwork to show it. It's all, shall we say, in the air.
We don't have mandates, but those patients are out there.
Right.
They're discharged and they're home,
Right.
and they need this.
Right. Now, you're also saying that they do 8 patients a day.
Private.
But how close proximity is each patient to the other one as far as traveling time is concerned?
Yeah.
If you're going to be traveling these county roads, and you know how they are, you may not only be able to do 5 patients in a day, plus do your paperwork too.
That's the problem that we're having. We as a county, the legislators are blamed for that, have not provided the nurses with laptop computers to do the paperwork. We have refused to do that, I understand, up to this point where I'm 6 months into the job. I guess that's my only excuse that I have. What's that?
They're not going to do that. They're not going to provide.
The private agencies.
Well, yeah, they will. That's how they get the aids done. They'll have the more technical stuff. So I understand. I'm not,
Yeah, we don't have all the answers.
Jack Andrews telling over in Plum.
Yeah.
Mr. Andrews assured me that he was not starting up in Plum. He'd have nothing to do with this new agency. I asked him that the other day, because we've been hearing that floating around. I said, Mr. Andrews, what is your tie with this? And he says, none whatsoever.
They had a meeting with us, Mr. Plum was at that meeting.
Yeah, but I mean, as far as Mr. Andrews being part of the not-for-profit organization.
That was our understanding when we had a meeting with him, that Bill Plum was there and this agency would be with all of us. Bill Plum would be involved with that also.
Well, if that was that group, whatever group, the county legislators have not decided or haven't even heard of any presentation of any group. Mr. Plum is just one of many organizations out there that would like to do this. CHP is, we understand, since they've been bought by this new company, I can't think of the name. Kaiser is one of the largest companies in home health care in this country. So we're just saying, it's out there. What worries me, if I may make this one statement, is that I don't want, as a legislator, representing not the nurses, but the patients out there, I don't want it pulled apart piece by piece, and we're left with all the no pays. And the nurses will eventually all fall out one at a time because we'll lose part of the structure. CVPH comes in, takes some of the patients. The CHP comes in, takes some of the patients as they apply for a license. We're left with the no pay, and the taxpayers pay all the burdens. When we met with Mr. Plum, and Mrs. Paquette was there the other day, he came to one of our health meetings, and I asked him specifically, with this not-for-profit, would you take all the patients if we did this? He says, absolutely, all the patients would go, whether they were paid or not for pay.
That's the Tri-County.
That's the Tri-County
Yeah.
proposal. I'm just saying what, you know,
What's the guarantee?
the way the board would be structured.
You know, is there be an overseer?
We'd have two, either a county legislator or the health department would sit on each. I can't, you know, I'm just telling you the structure, that's all.
So the county would still be involved, even if it was privatized? Are we looking at the county?
Be on the board.
The county being involved?
Yes.
With some question of control as to what
Policy
it is
making,
doing
yeah.
and what?
I don't think we would let it be established if it weren't that way. Because we are all concerned about that.
So would the employees remain county employees also if the county is overseeing part of that? Why would that be? Why would the county want an interest if?
Well, the county would no longer have a license, so we'd be into a private agency.
We're concerned about the patients.
Right, and so are we. But I'm also concerned about my job.
Yes. Well, I think that we have addressed that a number of times. We have asked these people, whether it was Evergreen or anybody else or the hospital, that your pay would be very, very comparable to what you're paid now.
But most of us are worried about our pensions that we already have vested in. You know, it's really, it's disheartening to know that as of now, we aren't losing money for the county. The landfill was in debt. The landfill was losing money. How long did the landfill lose money before they're being leased? But those county employees are also staying county employees. Why, in fact, could we not stay county employees and work under a private agency just as Casella is keeping the county employees at the landfill? This is most of the people that work there. This is our main, I mean, we're concerned about the patients, don't get us wrong, but we have to look out for ourselves too.
And I think that one point, if I may say that, what I said earlier, and I'm not here to argue with you about this, I don't want to do that either, is that my concern is, as nurses now, if we get picked apart piece by piece, it may take 2 or 3 years now, I don't know how, I have no idea how long this would take. It may take 10 years. Maybe we're talking about something that won't happen for years. I have no idea. All I'm saying is, if we see CDPH, which has already applied for a partial license, and I asked the other day, what's their chance of them getting a partial license? They said very good, because they were specific about it. They asked for IV patients and high-tech work that we're not giving you the instruments right now to work with, because you could do that also, but we're not supplying the materials to do that. That's what I understand. So I guess that's my part, you as an employee, that I'm concerned about is, are you any better off if we let it fall apart, or if we get you another job?
Could you help us stay together? Could we get laptop computers? Could we get the high-tech instruments? You know, why couldn't the county supply all this stuff just like CDPH is? If we're not going to lose money by supplying and providing all this care, we could keep our jobs, we could keep people satisfied in the county, we could get the home care that we need, that we're providing now, that we've been providing for since, you know, how many years?
I think that would be our choice. Legislators would much prefer keeping our employees and keeping that service.
And not breaking these patients
But
apart.
I think it's going to happen. All these forces are forcing us to. And if there's a cap on Medicaid reimbursement, which is what's happened in the hospital, that's why the patients are being kicked out so early.
And that's been put off till January as of right now, they're capping on Medicaid. That's been put off till January as of right now.
It was supposed to happen in June,
Right.
which it didn't, and then they, yeah. And that's why I said, those are the unknowns.
Yeah. We're not looking to do this. That's the point. We were totally, you know, we had enough problems happening in the county without, but it came to
It
us.
bothers me that
Yeah.
that's our head of our department is looking for all these ways to break off instead of looking for ways to help the health department stay the way the health department is.
And that was one question that I had. Why did Mr. Andrus go out and seek private funding for this? If he had nothing to gain? I mean, I've heard
Yeah.
through
Where did it come from?
talking that Well, I'm not so much concerned as to where it came from, as to why he decided that he should go out after the county said, no, we're not going to give you the money. Why he all of a sudden decided to take it upon himself to go out and get funding for
Well,
the
it was
survey.
tri-county. There were three. Essex was also there, Franklin. And I think the money for the survey is not even from within this county. I think Uline Health Services and some other are willing to provide this.
$7,000 I think, from our government budget.
It was all private funding.
We didn't approve that.
We didn't approve that as a
We didn't
county.
approve that. Well,
I can't say.
Knowing Jack.
Because we had said no when he proposed it the first time. We
So he said
no.
he'd get private funding to do it,
Yeah.
and that's what he did.
We just can't understand why Mr. Andrus is so involved in this that he has nothing to gain.
I'm not his personal secretary, I can't. The only thing I did more than as a health department person, in February, Eastern Adirondack Home Care, which is the network that we're talking about, this three-county job, which is in Washington or in Warren and county, other counties in the Glens Falls area. I attended that meeting when they came up here for a conference they had at the college. And there's a doctor, I can't think of his name, from the Glens Falls area, who is trying to organize that area, tri-county thing. And there is some counties in this state that are really trying to organize some not-for-profits. I mean, because we were told that the hospital, how it will start its first 2 years, and they told us that at their meeting, they're going after the pay patients, because they need the money to start it.
Right.
Okay, so they're going to buy the labs because they're going to have to pay patients. They're going to leave us, and I guess that's the scary part.
Yeah, I guess the scary part for us too is how are these Medicaid people not gonna fall in the cracks? Because why would Bill Plum wanna take Medicaid or charity care patients if he has nothing to gain? If there's a cap on the Medicaid reimbursement, he's also gonna look for most of the private pay and Medicare, but he can't have the Medicare without the license also, without
He
the
told us
job.
the other day when he was at our health meeting that we have about 360, Mrs. Pockett says, patients. He's managing now, was it 1,400 patients now? And he said the cost share, especially in the management wise, would really lower the overhead. And I'm just telling you what he was telling us
We
that
have
day.
employees that work for Bill Plum that make, a registered nurse makes $5.50 an hour. How can people live on those wages? A registered nurse? That's where they make up for where they can cut costs is benefits and wages, and how can people be guaranteed that the pay is going to be there, that the benefits are going to be there? It just doesn't seem, why break it up if at all it can be held together? If we can fight to keep it together, if there's things we can do to improve what we're doing now, we should be looking for those ways instead of looking for ways to let it all go.
Yeah, we agree. It's just, but we're at the stage where we're looking at it. The survey's not back yet. I think if you were to ask any of the other 8 legislators, they'd say, I don't have enough information at this point. I mean, and they know less than Joe and I. We can answer some of your questions, but they know even less. Yeah. So it wasn't anything that we've really gotten into yet, too. So there was a question back over here.
Is this starting a trend in the government that you're going to go to this privatization?
Privatization is getting bigger and bigger. Yeah.
I don't see that people are so much in favor of doing everything that way. I think government people have more concern for the people that they're working for. Then a private concern would take over, they're not going to care.
Well, we serve everybody, yeah. Whereas at privatization, you don't know who's going to get left out, but we certainly would be aware of that, yeah. That's a concern. Yes. Yeah.
To follow up on that, I am a Clinton County Health Department nurse. And when I receive a referral on a patient who has a particular problem like high blood pressure, and I go out to that home for the first time, I don't just run in the door and take his blood pressure and have a 15-minute visit, so therefore I could see 8 in a day. I go in there and I look at the whole patient. I look to see, does he have enough food? Does he have anybody to help with his care, a child or a wife? I look to see, does he have enough heat? Is his home falling apart? And because we are all county agencies that work with this type of problem, I'm able to interact with them and pull in the help that this patient needs in order to remain independent in his home. I don't think that a private agency would care about doing that. They would be more interested in running around and quickly seeing 8 patients because they can make that much more money. They don't care about the people. I've sat down and I've filled out Medicaid applications for people who didn't know that they were eligible. I've filled out EPIC applications, ISEP applications. I don't think a private agency would do that. And that's why they can see 8 a day and we only see 4.
Your point is well taken. I believe that's true. Yes, Mr. Zubrano.
What I have to say, and I'm going to be very bragging about the healthcare system that we have right now. I have had occasion to use it, and it was nothing but the best. I will change it.
Thank you. We're very happy with it too. We have no complaints. I mean,
We hear that the nurses are doing excellent. That's not the problem.
that isn't the problem. As I said, we didn't go looking to do this. Huh? Yes?
I just left the VA hospital, and all cutting back. This is why they want the county and the state to pick up all the slack. All right, the VA I was in is going to close, like the one did formerly up in Pepper Lake. I was there when that one closed. Now the same thing has happened. The government is taking money from the state, and the state, well, they're having a hard time to get it to put it back where it belongs. But I happen to be a patient at Evergreen, so I know what you're talking about.
You're a patient family
Yes, I
services.
am.
And that's a private.
It is.
And are you happy with their service?
Very. In fact, I'd much rather be closer to home than 3 hours away.
Do you have any other questions or comments or concerns for Celine or Joe this evening? You know, I don't know if anybody got their questions answered or whatever. I didn't listen to the whole talk here, but the thing is we wanted to have them come here this evening to try to shed some light to everybody that is concerned. And, you know, you can go back home and think about what was said, think of more questions. And hey, we've got a lot of legislators for Clinton County here. You know, voice your concerns. Maybe set up a meeting. If we need to set up a meeting with them or something, some evening, maybe we should do that. I don't know.
And I talked to Mr. Andrews the other day, and I told him that we were coming here. And he said anytime, and whether we want to use him as the bad guy or not, he said he'd be more than willing to speak to this group. And that's the way to get informed about this, is not getting upset with us, but trying to get the information and ask him what he's doing. I mean, that's up to you folks, but I'm just saying, he said that he'd be more than willing to. And I'm just offering you that as a...
I have some concern with that because I called his office 2 or 3 times when I did that audit. And I never got a phone call. He never returned my call.
Well, if you could
So
get
that,
into this
because I
meeting...
like to get both sides.
But
You
if
can always call me. I have 3 phone numbers. And if I'm not there, they're message takers or people. So feel free to call me anytime.
Could you tell us what those 3 phone numbers are?
Absolutely. My office is 298-2000. My home is 298-2001. And my camp that I'm at this summer is 298-2612. They're all in the phone book.
I serve the Champlain Rouse's Point area. I have a lot of patients who are very concerned. 298,
2001 is my home, I have an answering machine, and 298-2612 is my camp.
Am I free to give these out to the patients?
Oh, absolutely. My numbers are in the book, directory. Also, we have our county legislative meetings, the second and fourth Wednesdays, second and fourth. And there's a time for visitors forum. Anytime you feel you want to address the legislature, feel free to come. Our meetings are at 7 o'clock.
Most of my patients are too frail to do anything like that. I would like to say, though, that if the legislators hold on to that child license, then I don't think we have to worry about all these other private agencies popping up, because without the child license, they cannot bill Medicare and Medicaid, which is the bulk of our business.
We would not let it go very easily. I think if our hand was, if we were really, really pushed, that's my personal, and I think I can speak for the other legislators also. It's not something we turn over tomorrow, for sure.
We know this will be a completely different problem than a landfill, because this is a people problem. This is not a, and it's going to be a very personal problem to a lot of people. It's going to be very personal, because people are getting cared now, and they're worried about how they're going to be cared for.
The thing of it is, they're not just getting care, they're being cared about. I know that from personal experience.
That's true. And that's very important.
I would like to see more in the newspaper, more on the TV about this, because many of the residents of the county don't really know much about what's going on.
Yeah, it's hard to have much because there isn't, you know, you saw what I could tell you tonight. It's an evolving thing, it's being studied, we don't like it, we're faced with it. What can we say, you know?
The study will be done within a week or two, and it'll be presented to the legislators. At that time, hopefully the paper, we can't tell the paper how to do this, but the paper will pick up the report and you'll be able to see it.
Well, if you get in touch with us, we'll be glad.
Yes, I'll be in touch with
But that report is talking to Mr. Andrews the other day, I think it's due, if it's not this legislative meeting on Wednesday night, it'll be the following Wednesday,
you. 25th.
25th, that it'll be out, and we'll know then what the study. And there again, what will that say?
And what will we do about it?
Yeah.
They were hiring a consultant. I think that was the money. It was an outside agency that was going to do the survey. Yeah.
Right.
Be in this area, or how?
If privatizing it would help it compared to the public system.
So if this is self-serving for an individual, they could hire somebody that was in their favor.
I understand Mr. Plum did.
And another thing Mrs. Paquette did say, say for example, this is just one, the one that Mr. Andrews is talking, the 3-county one. It would take 3 county legislative areas to do this. Essex as a legislator would have to vote to take it. Clinton would, and Franklin, because this could not work, because you talked about areas. That's their purpose, is to get, so if you're next to the Malone line or to Cherubusco, you want to be able to go into Chateauguay, you don't want to come all the way back to Glasgow to your patients. That's their purpose, is to intermingle patients, take away the county boundaries. Because 2 other counties don't have health agencies. Franklin or Essex don't even have public health agencies. They just have a home health care agency.
It's my understanding that Franklin and Essex do not offer the 24-hour care. They don't offer evenings and they don't offer weekends.
Well, I wouldn't be able to tell you that.
I would hate to think that the Clinton County nurses would have to travel down there to provide that service for them.
Well, I would presume that would be equal work for the whole,
If it ever.
if that was the part, you know.
Yeah.
And what Mr. Andrews is pushing, and you may think I'm defending him, but I'm not, I'm trying to be objective about this, is that he thinks a not-for-profit would not be so concerned with the dollar as much as the care, and you can believe that or not. I mean, you know, if a person comes here, and we've heard this said by a different Mr. Tesher, even from Evergreens, that if some profit organization comes here and is based out of New York City, the money won't even be in this area. It'll go back to its base area. Is that good or bad? I don't know, and it'll be all money driven. It'll be, you know, I don't know, I just,
Unfortunately, healthcare is money-driven these days. I wear a different hat. I sit on the board of directors at the hospital. And the bottom line has to be black ink. If we're in the red ink, they'll close the hospital, as you've seen happen at Moses Ludington and other places. So Kevin Carroll is constantly looking for ways to increase revenue and cut costs. And you've heard the complaints about the hospital. They've cut staff and they've closed floors.
I think we should be doing the same thing. Looking for ways to improve and not increase our costs to the county.
But
There's a lot of ways.
at the same time, we don't want the county residents to suffer the way they are.
absolutely. That's my intent.
The hospital's method of cutting costs does hurt the people.
And they were telling us when we met with them, they've shot half the beds in that hospital. Half the beds.
And they think they're gonna make more money that way?
They're forced to. I don't think they have a choice. Health insurance, I mean, said that
Makes sense.
half the beds are shut down.
Well, Medicaid and the private, the insurance companies are cutting back on the reimbursements in the hospital.
Just same thing with your landfill.
Yeah.
Customers went to other counties and we're losing money. The hospital's doing the same thing, they're raising the prices and they're not making money, so they're gonna close too. Could happen in Plattsburgh too.
We have no control of what's being brought into the landfill anymore either. Same as in healthcare. After the child is gone, there's not going to be a control. How could there be?
We won't have it. You're absolutely right. The licenses are controlled. We have a license.
You mentioned that the hospital is going to go into the home care services. They don't have any trained nurses there to do it. They don't have any nurses even on the floor to take care of the patients. You know that. They got more administrative people downstairs than they have on the floors. And that's not the way to run a hospital.
I don't know. They're the ones that applied for the license. How they'll carry this out, I have no idea.
He's telling you. Carol, I mean.
It was in the paper that he applied for the license. Now, how long it'll take and what the answer is, I have no idea.
What are your thoughts on this?
Yeah, we need to wrap it up here. We got a couple meetings we need to get started here. Do we have any more quick questions, Joe or Celine? If not, I want to thank both of you for coming this evening. Calvin, I appreciate you coming and taping this.
Thank you for
David,
inviting
Brenda,
us.
It was nice to have you here to get some info for the business connection there also. So I want to thank you all for coming. Again, remember, you know, if you got those questions, you need to start talking with your friends and your neighbors and your cohorts there and start coming up with questions that you might be able to bring to our legislators and, you know, see where it's going to go from here. So, thanks.
Thank you.